Good morning to all distinguished guests, healthcare leaders, colleagues, and friends. Let me start by thanking the Health and Environment Leadership Platform and Jupiter Hospital for bringing together an important community of practitioners, policymakers, and thought leaders to promote a key imperative. That is, sustainability in healthcare is no longer optional, it is essential. Healthcare exists to protect life. However, globally, the healthcare sector contributes nearly 4 to 5% of greenhouse gas emissions, which runs counter to its goals. In India, as healthcare access expands, which is both necessary and welcome, the sector's environmental footprint will also grow unless sustainability becomes integral to how it designs, builds, and operates healthcare systems. Today, sustainability in healthcare must be viewed not merely as an environmental obligation, but as a public health priority, an economic necessity, and a moral responsibility. India is already witnessing the health impacts of climate change, heat stress, vector-borne diseases, water insecurity, and increasing frequency of extreme weather events. Hospitals stand at the front line to tackle this crisis. At the same time, healthcare facilities themselves are energy intensive institutions, generating significant waste, consuming large volumes of water, and depending on carbon intensive supply chains. The question before us is simple: how do we ensure that healthcare heals without harming? And the answer is sustainability should become core principle of healthcare delivery. So, in this context, what is India's policy direction and what is NITI Aayog doing? At NITI Aayog, sustainability is approached through a systems perspective, integrating economic growth, environmental responsibility, and social outcomes. India's commitments under climate action frameworks, the nationally determined contributions, and the sustainable development goals recognize health both as an outcome and as a driver of sustainable development. In the health sector, NITI Aayog has been working towards strengthening health systems through innovation, digital health initiatives, preventive and primary care strengthening, and promoting efficiency and resilience within healthcare infrastructure. Increasingly, sustainability considerations, energy efficiency, resource optimization, and climate resilience are being integrated into discussions on future health system planning. Three policy directions are particularly relevant for healthcare. Number one, resource efficiency and circular economy. Hospitals must reduce waste generation, improve segregation, recycle where safe, and optimize procurement. Sustainable healthcare improves efficiency while lowering costs. Second, energy transition. Energy efficient infrastructure, renewable energy adoption, and smart building systems are environmentally responsible and economically sound, with many hospitals already demonstrating operational savings. Third, climate resilient health systems. Healthcare facilities must remain functional during climate shocks such as floods, heat waves, and power disruptions. Resilience is now as important as capacity. Another component of climate adaptation would be to strengthen the healthcare infrastructure to tackle new disease vectors, outbreaks of epidemics as a consequence of extreme weather events. Climate resilient healthcare is an emerging area of work for NITI Aayog. Encouragingly, India's healthcare sector is already showing leadership. Initiatives led by hospital networks, accreditation bodies, and platforms such as HELP demonstrate that sustainability can coexist with clinical excellence. Sustainable hospitals are often safer, better managed, and more patient centric. HELP, supported by PHFI and Healthcare Without Harm by, deserves appreciation for creating awareness, building leadership engagement, and bringing sustainability and climate health discussions into mainstream health dialogue in India through a robust network. HELP's initiative has played a vital role in enabling collaboration, knowledge sharing, and practical implementation discussions, helping translate policy intent into action on the ground. Sustainability initiatives, energy optimization, reduction of single use plastics, water recycling, and green procurement ultimately improve operational discipline and patient outcomes. Cleaner environments and responsible resource use directly contribute to safety and quality of care. The next phase requires scaling. We must move from isolated success stories to systemic adoption through standardized sustainability metrics for healthcare facilities, capacity building of administrators and technical teams, integration of sustainability into accreditation and quality frameworks, financial models that reward efficiency and long term thinking, strong public private collaboration. Technology will enable measurement and monitoring, but technology alone will not solve the problem. Leadership will. No single institution can drive this transition alone. Partnerships between government, hospitals, industry, academia, and civil society are essential. India's strength lies in its ability to innovate under constraints. Sustainable healthcare solutions developed here can become models for other low and middle income countries facing similar challenges. As we look ahead, sustainability in healthcare must be guided by three principles: do no harm to patients or to the planet, use resources responsibly, build systems that endure future challenges. The hospitals of the future will be judged not only by clinical outcomes, but also by how responsibly they use energy, manage waste, and contribute to healthier communities. Sustainability is ultimately about stewardship of health, resources, and future generations. India has an opportunity to demonstrate that healthcare growth and environmental responsibility can progress together. With leadership from institutions such as Jupiter Hospital, the continued efforts of platforms like HELP, and collective commitment from all stakeholders, this vision is entirely achievable. I wish the summit great success and look forward to the discussions that will follow, and hopefully policy recommendations that NITI can take forward. Thank you.